Yeah, right, guys. Just quick one at the start of this one. Just be aware it is very text heavy. I'm having to get these out a bit quicker, just in preparation for Wednesday. So they are text heavy. I'll do my best to break it down and add to it. But remember, um, pause it throughout. Have a look at the information available. Again, it all should be available on Student Pod as well. Okay. All right. So let's jump into it. So at this point, most people accepting that germs are causing disease. So it's the germ that kind of need to be removed. Remember, well, by 1900, sorry. However, scientists weren't exactly sure how to do it. Herbal remedies were still around. Again, people were realizing that infection was everywhere. Dirty clothes, unwashed hands, equipment, all the ideas of avoiding disease by keeping clean made sense. Prevention was still important. The biggest change was the willingness of the government and the population to really step in. Okay. Again, this is where it gets a bit text heavy, so bear with me. But this basically summarises the difference between the hospitals in this period. So, firstly, there are only 5 hospitals in the country by 1700 because of Henry VIII closing them down during the Reformation. They hadn't really been any more built, partly because of lack of money. When the new hospitals did start to appear, this is normally from donations from wealthy and middle class people. Doctors were starting to get involved in them, which is quite important. So it's not so much where sick people are treated. It is starting to become places where sick people are treated, as opposed to Renaissance and medieval period where you would just be prayed over and given food and rest. Doctors would visit and get involved, so it is starting to really become this more place of treatment as from previous periods. Again, still not places where people would generally choose to be treated. A rich person would pay for a physician, remember, to come to them. And hospitals were picky. Patients admitted were the deserving poor, people who legitimately couldn't work or struggled to work because of a disability or a problem. Working class people just struggled for these medical bills. They struggled to pay for it. So this kind of new thing in the hospitals gave poor people the access to the trained doctors for the first time. Remember, before this period, poor people would be mainly looking to wise women, elder women of the area. So this allows them access to that higher training. So as the influx of people start coming in, they come a bit slack about infectious patients because there weren't separated wards. So this was a problem. It led to a massive spread of disease. Now, by the 1900s, wards were all split up into specific areas where you'd need surgery. Operating theatres had specialist department, new medical equipment. Cleanliness was really important. Remember, 1900 is the very end of our period, start of the modern period. It was all about preventing germs. Doctors were everywhere. You had junior doctors. The level of training is growing. New ideas are growing. Things about germ theory, etc. And the function of the hospital has completely changed. It is now a place of treatment. So that is just an overview of how things are changing in this period from 1700 at the start to the end in the 1900s. Okay. Right. Why has it changed though? Well, Florence Nightingale. So you need to know bits about Florence Nightingale and why she was so important. Firstly, a little bit of a background. Wealthy, experienced. She believes in things like miasma. She went to train as a nurse. she was really into this kind of role. It really takes off in '54 during the Crimean War, when Britain were fighting Russia alongside Ottomans, Austrians, French. News reports stated that the hospitals were not fit for soldiers to be treated in. So when Nightingale gets there, she sees how horrendous it is, how poor the conditions are. She seeks the permission from the government to give her more nurses to kind of sort this out and help them. She demands 300 scrubbing brushes. Just note these down. These are good ones in terms of how she changes things. Demanded 300 scrubbing brushes to get rid of any dirt near patients being treated. Nurses are organised to treat nearly 2,000 wounded soldiers. Clean bedding, good meals are provided. So Nightingale really gets the ball rolling with cleaning up. Again, she does believe in miasma. However, this doesn't diminish the impact she has, as mortality rate, that's how many people are basically dying, within 6 months dropped from 40% to only 2%. Huge statistic. Make sure you know it. Why was it popular? Well, it was popular. Why was she popular? Well, by the time she returns to Britain, she's seen as a hero. There was horrible reports about the conditions of the hospital over there, and Nightingale had such a big impact. It gives her credibility to then change things in the hospital going forward. This is so important to any question you can get on a 16 marker in particular, in explaining the impact. You need to know about her popularity and how this allows her to then make the changes to the hospitals themselves. So with this experience and this popularity, she wants to design new hospitals and she wants to train nurses. So what does she do? She wants rigorous training, making nursing a more professional job rather than an unskilled job. She sets up the Nightingale School for Nurses, where they're trained on sanitary matters. It's seen as a respectable occupation. This attracts more people to become nurses. She wants new ventilations, new cleaner, nicer open hospitals where air can flow freely. She wants the pavilion style hospitals where separate wards are built. This is to keep infectious and non-infectious patients separate. And she writes notes herself on the role of nursing. So this covers pretty much everything Nightingale does to have such a big impact. So any question that comes up explaining the impact, or even if you've got an isolated question on who had the biggest impact in prevention, Nightingale is huge. And please put emphasis on things like what she does with the hospitals and nursing, because that's the lasting legacy. The Crimean War and her impact there is it's really good, but it's kind of short term. It's this lasting legacy. It's this what she does that stays. That's important. It's where you pick up the marks. Right, getting on to Lister and Simpson. So again, apologies for the text-heavy slides. If I have time later on, I'll try and edit them more so they're easier. But however, just get it out to you is the main thing. So Lister, as we've talked about before in the Pasteur slides, he builds on this idea of germ theory. He kind of realizes that if microbes can decay rotten fruit, then they could also cause the flesh to rot. He starts testing different things, and he sees the use of carbolic acid in sewage systems, and he decides to think, right, if it works there, I'll soak it in bandages and see if this blocks the bacteria, and it does. It's successful. So he sprays the carbolic acid in the air during surgery, and he soaks the bandages to cover the wound. He starts, again, this is just a bit of background on how he looks for it, but he looks for the chemical and, again, sees it in the use of sewage systems, and then he tests it out on a patient with a broken leg, and the wound healed cleanly. So it shows his success. So what impact does he have? Well, he does publish his results in a medical journal, and shows 11 different cases where it's being used, and news spreads of how However, it spreads very quickly, outstrips kind of germ theory. The science wasn't understood clearly, so he had problems initially in getting this over the line. So it was tricky. It was tricky in terms of its initial impact. Right, who opposed it? So carbolic spray, again, it dries out the skin, leaves a bad smell. Some kind of surgeons didn't want to use it because they made their hands sore. And if they made the hands sore, how could it help the patient? People believed he was a doer rather than a thinker. They didn't trust his science. In the short term, because of these initial resistance, people didn't really follow it. Long term, though, had a massive impact because it leads to aseptic surgery and our modern day hospital and their wards and how clean they are, or sterile. So again, carbolic spray itself was only really a thing in the short term. Lister stops in 1890, but it does set the ball rolling to find these antiseptics. Again, as I've said just previously, surgeons started wanting to use antiseptic and aseptic surgery more to keep it clean, and other surgeons begin to look for the different methods of preventing infection. This is where you get the steam, the operating theatres where things are scrubbed, rubber gloves, etc. So Lister, the impact he has is massive because it sets the ball. It kind of sets the stage for modern day hospitals. Again, before this, doctors would not clean their equipment. They wouldn't clean their hospital coat, their white coats. Actually, they would wear their hospital coats or the doctor's coats uncleaned, so it still had the blood and pus from previous patient, because they believed this showed their experience. This showed the patients you're in good hands, but they were actually passing on disease, and the uncleaned equipment was was a death sentence. So Joseph Lister's carbolic acid and then the leading on to aseptic surgery, so important to prevention of disease. Right, and the other guy, Simpson. So what does he do? Chloroform. He basically takes a few of his mates. They start sniffing different chemicals to see which one would prove to be an effective anesthetic, and they find chloroform worked pretty well. Sniffed it, knocked them out. His wife found them. He wanted to test it further, but it had problems because if you give them too much, they never wake up. If you give them too little, they'll wake up halfway through surgery while the doctors cut open your stomach. So problems initially. Also, some people, it affected their heart, and even if you're fit and healthy, some would die. So there were the issues. But chloroform, it was used as a solution for pain, and Victoria using it boost the popularity in a similar way in the Renaissance, where William Harvey is Charles I's personal physician and the Royal Society get the backing of the king. This gives it like a royal stamp. It gives it like credibility, and more people are more likely to use it. First person to be knighted for his surgeries. It allows for more complex surgery. Right? That's why it's so important. They can go further than they ever had to try and save the individual. However, one of the problems was the infection and the bleeding, which could cause bigger problems. So it's one of those. Whereas it's the first stage in this progression of numbing the pain, but it also has other significant issues that it needed to overcome. Who are against it? Well, a lot of people didn't trust it because these deeper surgeries before carbolic spray, infection and bleeding were massively problematic. If a doctor delved too deep into the surgery, it would cause too much blood loss and the patient would die because of that. So they were still kind of testing it out in terms of how to best use it. You've also got the religious groups who believe that, God meant you to have pain. You needed to feel it, especially things like childbirth. And some doctors believe that patients were more likely to die if they were unconscious rather than awake and screaming. So these were just a few of those who pushed back against it. The way we can use them, you got a 16 marker, and you're thinking about the AO3, so your judgment. You need to be thinking, right, if I'm who's had the biggest impact on prevention of disease during this period. If you're talking about Lister, you might be like, well, it's really good, but even he stopped using carbolic acid in 1890s. Jim Simpson, you might be saying, well, he was, so important for chloroform allowed for deeper surgeries. However, you had these that opposed it, which limited its impact. And then you might focus more on Nightingale, saying, well, Nightingale, she dropped mortality rate because of dropped mortality rate in the Crimean War, but then went on to, lead the profession for nursing and the development of and the layout of the hospital. So that's kind of how we can phrase it. Right, again, sorry it was very text heavy there, guys. I'll do my best to try and keep some of them a bit shorter, but I'm just trying to get them out to you now. All right, I'll see you next time.